welcome once again to the Empowering Patients podcast. This is your host, Theo Harvey, and I'm excited about what we're going to talk about today. Typically, we talk about remote patient monitoring, chronic care management, hospital at home, but today we have a special guest, Mr. Jon Brown. Hi, Jon. How are you?
What's up, brother? How you doing?
Doing well, doing well. So Jon Brown has extensive background with civil and software engineering. Jon began his entrepreneur journey 25 years ago in technology and communications while he was training at Kennedy Space Center in JPL. These experiences led to co-founding of Midnight Online in 1996 and a college-born technology startup that transitioned in 99 into the Midnight Group, an award-winning full-service integrated marketing and creative solutions firm. In addition to consulting, Jon is the founder and chief advocate of Black Men's Health, an initiative laser focused on creating more balance through health in men of color that he has been cultivating since 1999. A seed planted more than 20 years in the making, now actively working on bringing this vision fully to fruition and deploying this platform and associated resources on a global scale. Jon, that's great. So thank you for joining today. I think this is great for us to have you on the call as we kind of discuss the importance of crafting healthcare for specific communities, for in your case, for Black men. So I would love to kind of get into it deeply. So thank you for your time today.
Hey, good to be here. And since you got the mic set up and the producer on, maybe I need to have you do all my intros. That was a good Barry White. Got your Barry White voice on. I love it.
Yeah. I'm not new to this. We do this a few times.
That's right. Amen. Not new to this.
So thanks for doing this. So first, we usually get into the news. There's a recent study on medical debt. And they said even with 90% of Americans have health insurance, recently they found that medical debt at households were at 17% of all their financial load. So basically, almost 20% of Americans have medical debt. And this is something that's, this was taken in 2019. So imagine after the pandemic, I'm assuming these numbers have, increased. They said 23 million people, nearly 1 in 10 adults, have significant medical debt, right? So the survey of income and program participation suggests that people in the United States owe at least 195 billion in medical debt, which affects about 16 million people in the US. So this is huge, kind of related to our conversation today. They found that middle-aged adults and Black Americans were more likely to have significant medical debt. So for instance, African Americans looks like the share of adults who have medical debt, 16% of those who had that medical debt were Black. And then, kind of also related to our background in rural and South areas, they saw that the South led the pack with about 12% of all, debt coming from that area. So, Jon, this is something that, we need to talk about because I think when we talk about African Americans and healthcare, medical debt, the financials that are related to that, this is something that, we're seeing more and more of. What are your thoughts when it comes to this kind of, what's happening right now in healthcare and how it's affecting, African Americans?
Yeah, medical debt is a serious thing, right? And sometimes not controllable, right? You don't choose to have an emergency event or a medical event, right? Sometimes these things come upon you, and depending on what kind of setup you are in at that stage of your life, that could be a significant burden, which is a challenge. I remember, I think I was working for local government. In all instances, no, that's not true. Not the baby boy. I have a 15-year-old, a 12-year-old, and a 7-year-old, but at least the 15-year-old and the 12-year-old, I was working for local government at the time. A blessing to have that, those health benefits when having a child. I remember looking at the hospital bill, right, and seeing what my copay paid and what the rest of it is, and that's a very expensive situation to have a child to be going in there. So having other situations that you didn't plan for could be, severe. And Theo, we're talking about medical debt potentially on top of other debt, right?
Exactly.
You have some beautiful paper on the wall back there, respect, but a brother like yourself or myself choosing to get education and even higher education at times that can be, debt in itself. And everybody, I don't know about you, but I don't have a rich uncle that decided to write me a couple of $10,000 plus, maybe $40,000, whatever it is, to get some education. So yeah, and of course, we're not even talking about everyday living, which a lot of people have debt in general. So yeah, that's a challenge, Theo.
Yeah, I agree. When you say personally, yes, I've incurred debt as well. I remember my wife was first pregnant for our child, and everything was good. Had the baby, forgot about it, then I got that bill, and it was definitely something significant. Even I had health insurance at the time, but co-pays and paying the doctors to come in, the aftercare, it just started to add up. And so you're right. We don't. I mean, my last name is Harvey, and I have an uncle named Steve, but he's not that
There you
Steve.
go.
I don't have those resources either. And so, like you said, we're, some of the blessed few. And so, you think about other folks who kind of go through that. And once you have your health loss, you're at a loss to kind of pay for that. And so, I think the hope is, medical innovations, solutions, initiatives that you're kind of building. I think, we can kind of help with that, if people start looking at preventive ways, but also getting access to the care when they need it. I think they said
Yeah.
during COVID, a vast majority of people didn't even go see the doctor because of,
Yeah.
the lockdown. So I'm sure those numbers have went up significantly, unfortunately, now in 2021. So
The,
it's definitely something we got to be concerned about.
not only access to healthcare, but I think just access to the information, right? As you know, I've been in an entrepreneurial journey since 1996. Again, I just talked about local government. I worked in local government from 2006 to 2006 to 2008 and 2008 to 2015, Gadsden County and Leon County. But other than that, other than a little stint doing some agency work, I pretty much have been on my own. So having access to information is vital, right? I mean, people talk about, the Affordable Care Act and Obamacare and, all of that good stuff. And that information is out there, but you got to understand how to navigate that. And sometimes just walking in the door, if you are not aware or if it's just very intimidating, you can easily choose not to deal with it, which means that, again, if you, have, hypertension issues or diabetes or sickle cell or whatever it is, if you're not covered, you could potentially have coverage if you knew how to navigate the system and got access to the information. There could be benefits to help you, but you also have to be warm to going into environments where maybe you don't have the information and receiving the information. And insurance in itself can be a class system, right? I mean, Theo, depending on who you work with, you could have that good insurance, what we call that Cadillac insurance, and you could potentially not have that good insurance, which means that, in that same scenario, you could be paying a lot more for a copay or a lot more for other instances of something that you need that are a specialty. So yeah, man, the medical.
It's almost like you need a degree to read your medical bill, right? I mean,
That's right.
sometimes you don't even know where the copays are coming from and all that. And then, I think there's some laws that were passed, right? No surprise billing, so hospitals are not supposed to surprise you with these
Right.
known bills. So we'll see how well that gets, implemented, right? It was one thing to make a law, another thing to implement it. But I think hopefully those are, starting to help people be aware of, what the costs are so they don't get into this debt. And you're right, this is, in addition to other debt, household debt,
Yeah.
car debt, credit card debt. So it's just tons of things. So, with that being said, thank you for the discussion. I think this leads into a great, transition, when we talk about, Black health, Black men's health and the help that they need. One of the things that I'm really interested is like, crafting healthcare for specific communities who suffer from, things like this medical debt and not knowledge and access. So tell us a little bit more about what led you down this path to create the Black Men's Health Initiative.
Yeah, so my background is engineering and computer applications, and I had a blessed experience of being in the NASA family, as you did, Theo, and did some work at Kennedy Space Center. Amazing experience. Did some work at the Jet Propulsion Laboratory, and at JPL had a lot of early internet technology experience, specifically on the back end. And in that work, I learned how to build functional systems and then learning how to, tie them into the World Wide Web. And this is early, man, right? This is 94, 95, specifically 95. And was able to take this knowledge, come back to campus, Florida A&M University, the best HBCU in the nation, and started a business in undergrad. And when you're in the space of doing website development in 1996, you're really in a digital real estate game as well, right? So not just your execution of services and consultation, but also in the sense of like, hey, you can buy up digital real estate and potentially own that forever. So we did. There's a lot of domains that we acquired, especially just knowing how to do it, right? I mean, and again, especially being an entrepreneur, the path from 0 to 1 is tremendous, right? I mean, you got to know how to get there and turn it into something, not just an idea. So understanding how to do that pretty quickly is beneficial. So we had and have a lot of digital real estate, and one of the acquisitions I made along the way was blackmenshealth.com. That's 1999. That's a long time ago, Theo. But even looking at the path there, right, coming across an email. I mean, I remember the day, right? We're talking about like early August 1999, probably like August 2nd or something of that nature. If I look back on it, 1999, sitting in my office with Midnight, sent an email related to Black women's health. Immediately going to check out like the blackmenshealth.org, which was taken, and then checking out blackmenshealth.com, which was available, and immediately buying the real estate, like immediately. And one of the reasons that I bought it, my thought at the time, which is still very relevant today, is just not enough representation, right? At the time, we didn't have all of these devices and, just at the level that it is now. So newsstands and physical print magazines were still huge. And Theo, in 1999, as well as today in 2022, if you go and look at the newsstand of men's magazines, period, but definitely related to health, there's just not enough us, right? It's a lot of white men, period. And the women got it under control, man. And the women have done far better over the last, decade or so. But if you're talking about tall, short, fat, skinny, all beautiful colors of the rainbow, no matter what it is, if it's wedding dresses or photography or gardening or, guns or cycling or whatever, the women got it under control, just diversity galore. But for men, especially big magazines, Men's Health, Men's Journal, Men's Fitness, it's like a lot of white boys, right? And if there is a man of color, specifically a Black man, you and I know who they are 200, 300 yards away. It's like, oh, that's Idris Elba. That's Jamie Foxx. That's, Kevin Hart, Barack Obama, which is what I call kind of like the 2 to 3%ers, right? Those are people that are like amazingly aspirational, but obtainable. Like, I mean, how many more Barack Obamas are they going to be, right? I mean, like Jamie Foxx, literally in a movie, his character's name is like Stacks, right? Like Mr. Stacks, right? I mean, it's like, and Idris Elba, they're considering Idris Elba to be like one of the Black James Bonds. I mean, like that's like a small percentile of the population. So what about the 97 to 98% of us, right? Just like regular brothers, just trying to figure it out. That's what Black Men's Health is about, man. Just creating this platform is really about creating more balance through health for men of color, specifically Black men. And we are covering that in, holistically, right? Mental, physical, financial, spiritual, social. So this is not just about how to have rock hard abs and how to have sex all night long, right? This is about, everything and balance, right, Theo? As you might know in academics, right, in academia as well as in the medical professional, a lot of times we're asking men, specifically Black men, to go from 0 to like 11, like beyond 10, right? And that's not always feasible. So, we are approaching men. We want to be relevant. We want to be approachable, and we want to obviously we want to give men information that's accessible and palatable to them. And you don't have to be on 10, right? I mean, maybe I can get you from 0 to 1. And if you can get from 0 to 1, maybe you can get to 2. If I get you to 2, maybe you can get to 4. And maybe 4 is all you'll ever be. But 4 is a long way away from 0, right? And trying to get somebody from 0 to 10 is like a lot, right? Trying to get somebody off the couch to like run a marathon is like, what? A marathon? We got to take an approach to like move men. And as we say often, kind of this mantra of this is not a arm around the shoulder. This is like a poke in the chest. This is like real life. Like, Theo, you got like a family to raise, like a community to build and a legacy to live. Like, we don't have time to be playing with this. This is not like a nicety. This is like, brothers are dying, and we have to do more. That's what it's about, man. Easy as that.
No, I mean, I can see your passion around this, and and definitely going back, to 1999 and just having that thought and just putting it out there into the universe definitely, key to like building something like this, especially if it's more of a movement, more of a, a passion project. And this is, definitely along those lines. So I appreciate you doing that. And, definitely you're right. I talked to Dr. Lee Green over at Moffitt Cancer Center. He had talked about this as like, research that goes into Black men's health. It's almost nascent, right? And unfortunate. And to your point, but when you look at all the other health indicators, he said, the Black men are always at the bottom of those lists. Like,
The, the first of the worst. That's what I
yes,
say. The first of the worst, right? Yeah.
comes to like heart disease, diabetes, he said we're all, Black men are always there, right at the bottom of that list. And so it's something that, I think is needed and necessary as we start to think about the future and, strong families and just, what's happening for this community. So now thank you for thinking through that. I mean, so if you kind of think of it like high level, so you built it out, you kind of talked a little bit about how you're approaching it from all the facets of a person's life. So what do you see next for this organization, and how do you think you're building it out with partnerships? And we'd love to kind of get your grand vision of how this would work out in the next 10 years, 20 years.
Oh man, the vision is an octopus. That's a dangerous question. We don't have enough time for that today. But sharing with you again, obviously, having something that I've been incubating, since 1999 is challenging in the sense of just, what pieces to break off to execute. And I will tell my team at times, listen, when we're having discussions, talk to me about things that are tangible. Talk to me about things that we can, really, create impact. Because again, there's a lot in here, right? A lot that's been baking, and it was time to get these things out of the lab and into the world, because men need these, and they don't have to be perfect. And I have to be careful there, Theo, especially as a communications marketing guy. Like, I need things to have the I's dotted and the T's crossed, and it be polished, right? If somebody's baking, even somebody helping me bake the cake, I need the icing to look like presentable when we're passing the cake along. So that can be a challenge for me, but eventually it was just time to do it. And I'll tell you, even pre-pandemic, probably 1999, I even go back further, probably 2012, I put together an advisory team really to kind of set the mission for Black men's health. Like, look, it's time to like put some things in motion. It never had enough oxygen. It never had enough time. It never had enough attention. It never had enough resources. If I had to do it over again, as you know, Theo, with my first business, Midnight Online and the Midnight Group, Black Men's Health was a project. I could have gave it to the people that had the expertise in the room. They could have built this out. And we did a little thing to kind of just touch it and kind of preview it, but nothing serious. But it was time to give it some time and attention. Like I said, 2012, got the advisory team together to kind of set some tone. 2015, resigned from county government with one of the reasons why I wanted to give Black men's health some more time and attention. I knew I couldn't do that immediately, right? It's a startup. So got into some other work that could help, feed the family, including, consulting, communications and marketing consulting. And 2017 went into an incubator here in Tallahassee, Florida, Domi, which is amazing, and helped me really kind of pull some of those thoughts out of my mind and get them down crystallized. 2021, I actually went into a cohort around fundraising called Founder Gym, another amazing experience. I knew it at a minimum, it would have me, connect with some other entrepreneurs that were moving in that direction, and definitely help me lay down a foundation for, raising funds if I needed to. But 2019, I kind of really got frustrated, Theo, and just said, look, brothers need this. It doesn't matter how polished it is. I need to go. My wife and I have been doing experiences in some way, shape or form. If it's, summits, symposiums, conferences, whatever, probably since 1998. So we could do that with our eyes closed, and we're not scared of it. It's not intimidated. We could go big, bold. We could go small, whatever it is, we could do events. So I kind of put a line in the sand in 2019 and said, Black Men's Health is going to have some kind of experience in 2020. Like at a minimum, we're going to have a conference. And I don't care what that looks like. I don't care if it was 200 people or 2,000 people or 20 people, but we're going to do something. And we're going to do it in Florida, where I'm here. We're going to do it probably down in Central Florida or South Florida, Tampa, Orlando, make it easy for people to get to, and just do it, period. Put it on the date. June 2020, Men's Health Month, my dad's birthday, my birthday in June. Like, just put a date on the books and go ahead and do it. Had that mapped out, started pushing towards that. I was doing some local government support work. So obviously January, February, you're kind of seeing this come, right? With
Yeah.
COVID, right? And then, by March, it was a wrap. Like the world is shut down. So yeah, we shifted. I won't even say had to pivot because we already had, components built in that related to, back in the day, what we call webinars, right? This is a webinar back in the day, right? But this form of communication obviously became, like the norm in COVID, and it allowed us to get to some information and get access to some people immediately. So we took our, idea of that conference that was going to happen in June 2020, shifted into a virtual conference. And as we were preparing for that and kind of stacking the deck and getting all of the pieces together, one of my team members said, "This is ridiculous. Why are we doing this? Why are we trying to do this on 1 day, 2 days? Why not just space it out and give people the opportunity to touch it in different ways?" Which I thought was brilliant, because Theo, no matter what your interest level is, if your son or daughter have something going on and it's in conflict with the date that I have something going on for a panel that you want to be involved with, you're not going to be there, right? You just right. But if we spread it out, it will give you an opportunity to touch it more. So that's what we did. We spread it out. We had a summer lunch series, a part of this kind of discussions that need to be had, and amazing discussions, man. Just brothers talking to brothers about relevant subjects. As you know, you can almost finish each other's sentences in some certain scenarios because we're dealing with the same thing, and it doesn't matter if it's somebody Theo Harvey 20 years ago or Theo Harvey 20 years from now. Some of these lived experiences are the same. So we've done that. And now obviously we have the website going like really like raging in the sense of information. We have an interim editor-in-chief, Takuma Roback. He's a FAMU grad, also amazing journalist, has a skill and a passion related to, Black men's health. And we're just building, man, have some communications specialists or communications consultant. And my job is really to kind of continue to try to find resources and access to information just to build on that. I know it will come. I believe that activity will drive impact, and impact will drive revenue. And the more impact I can make, the better. The more revenue I can get, the more impact I can fold back into impact. And it's for real, right? I mean, it's like, I told somebody, I was in a meeting with the university recently, and I told him, Theo, I mean, you heard those pillars, those areas we focus on for holistic health, right? Mental, physical, spiritual, financial, social. All of that's amazing work. All of that's great work. We all need balance in those areas, especially brothers that are really, at the top of their game, right? You and Amin doing your thing. Sometimes you start to strategize and push towards greatness and excellence and more. Sometimes you are not doing the things to keep you balanced, right? And that's just for real with anybody, but especially in the Black community. It's not like we had dads that, woke up, and swimming 4 times a week or running 5 times a week. A lot of people just don't have that experience. So that stuff is not, inherently baked in. We got to, do the work to bake that in. So, we just continue to build, man. And I know, like I said, that meeting at FSU, no matter what we're doing in all of those spaces, all of that's important. All of that is important for balance. But at a minimum, if the work that we do, especially related to mental health, creates a scenario where we can give just one man hope to get to tomorrow, I've done enough, right? I've done enough. I mean, we got a lot of scenarios that a lot of brothers are choosing to not be here. And we have to figure out, how do we create spaces and places and faces that, again, relevant and powerful connections that somebody says, hey, I'm struggling for real, but I can deal with this tomorrow, right? And maybe through a brother like Theo, somebody that they could just see just doing it, right? Or they believe that Theo's is accessible enough where they can have a discussion. That's vital. So we're just doing the work, man. Just doing the work.
I mean, wow, a lot to unpack there, but I mean, is the passion around this again. I love what you said about the activities. I agree. Activities drive impact, drive revenue, and so that's kind of what we believe in startup world as well. Having more activity so you can learn faster and do more, and then you'll understand more. So I think that's powerful. And then what you're saying is just that impact mental health. was a stigma in our community for so long. And so now that people are speaking up, talking about it, and, they have apps now, right? Calm and other things where you see
Yeah.
LeBron James, communicating the importance of, mental health and peace. So everything you're saying, I think we want to see more of that. And look, I think, any small way we can connect you with the folks that we know, what we're doing with our space in the patient monitoring, helping patients who suffer from chronic conditions like high blood pressure, diabetes. A lot of them are Black men. Matter of fact, we did an IRB with a hospital where we were helping Black men who suffer from COPD. They were just coming to the hospital so much because they didn't understand what some of the causal factors for them to go back in. Simple things as taking an inhaler, and so we solved that for a small subset of Black men in Middle Georgia. And so, to your point, seeing that impact that we're having, even on a small level, and then increasing that across the populations, I think is key. But especially, the hardest hit, if you can change them, then you can, open the door for a lot of other folks. So no, this is very impactful, Jon. So look, this is our time. Thank you for your time today, just talking about your passion and helping the Black community, and giving people wisdom and thoughts on how they can shape it for their community as well when it comes to healthcare. So everyone, please like and subscribe on Apple Podcasts, Spotify, Stitcher, wherever else you listen to podcasts. Thank you all for being on this journey with us, and we continue to build better patient health. Take care.
Thank you, brother.